Hey everyone, thanks for checking out my channel. In this video, I'm going to go over cubital tunnel syndrome. What are 4 tips you can do at home to reduce your pain and improve your symptoms? So what is cubital tunnel syndrome? That's irritation or compression of the ulnar nerve as it passes around the elbow here. That nerve is going to go into the hand. It passes through the outside of the carpal tunnel, goes into the hand here, and is going to supply innervation, that's sensory and motor capability, to this side of your palm, also your small finger, and that outside portion of your ring finger. And so you may notice that you're dropping objects, you have numbness or tingling here. You may even notice atrophy, or these muscles get smaller in this area. A lot of times people will notice that their small finger kind of goes out to the side. It may look a little funny or kind of be abnormal with the movement and its positioning. And so if that happens, then you need to go through some different nerve flossing techniques as well as some stretches to try to alleviate that pressure, and then also start into some strengthening exercises for the intrinsic muscles of the fingers. And then lastly, we're going to work on some cervical retraction to kind of work on that neurological reset at the spine itself. Our first technique is going to be a nerve mobilization. There's a couple of variations of this that we'll go through. The first one you're going to do is you're going to make kind of this circle with your thumb and your index finger, and you're going to bend your elbow. As you bend your elbow, you're going to deviate or bring your wrist back this way, and then you're going to lean in, and then you're going to lean your head away, straighten out your elbow, and go back out, come back in again. Repeat that for 2 to 3 sets of 10 to 20 repetitions. An alternative version of that would be going out to the side. So what you can do is come out here to the side, and as you bring your hand up, you're going to lean your head in, and then as you go down, you're going to lean away. You can do it that way. Some people even prefer to, as the hand comes up, the head leans away, and then when the hand goes down, the head leans in the direction of that hand. So that's just your preference as far as how it feels to you. Next is going to be a stretching technique. We want to stretch this flexor mass area here because that nerve does pass through this area. So what you're going to do is extend the wrist back. You're going to take your hand, pull your fingers back. Now if you want to add an additional stretch to this, you're going to deviate. So you're going to bring the wrist this way. So the thumb's going to come back. So I'm pulling back into extension, and I'm also pushing my hand in what's called a radial deviation direction. So I'm going to hold that there. Hold that for around 20 to 30 seconds and relax. Go back in again, hold that for 20, 30 seconds and relax. Repeat that several times a day. Now, if that stretch aggravates your symptoms too much, if your fingers really just light up, it's painful, burning, tingling, it just really gets worse, don't stretch it as far. Back off, stretch it just a little bit, and then you can work on more of a stretch. Again, just repeat that several times a day. Now we're going to work on some strengthening exercises for the fingers. What you're going to do is kind of pull the fingers apart. That's known as finger abduction. I'm using one of these resistance bands. You're going to complete that for 2 to 3 sets of 10 to 15 repetitions. Then you're going to work on, I'm going to flip this over, and you can vary with the finger positioning with this, kind of what areas you're trying to work. So we're going to start off with just kind of a hook pattern. I'm just kind of curling my fingertips down. And so we're going to curl those down. I'm just working on curling down. I'm going to repeat that for 2 to 3 sets of 10 to 15 repetitions. You can also work on like a tabletop position or more of a palmar grasp. Pull the fingers down in this position. That's fine too. Just kind of play with that and see which feels the best and which ones it seems to work the best for you. Our last strengthening exercise, now we're going to work on finger adduction. That's where we're bringing our fingers together. So I had this piece of foam here. You can use a rolled up washcloth or just kind of whatever you have if you don't have the foam. And you're going to put this between the fingers, and I'm working on squeezing my fingers together. So I'm really working on bringing my fingers together. I'm going to squeeze and hold that for about 2 to 3 seconds and relax. Squeeze and hold that 2 to 3 seconds and relax. Repeat that for 2 to 3 sets of 10 to 15 repetitions, and work your way, not just with the small finger and the ring finger, but you can work all the way down. Even though we're getting into some of these other areas over here, maybe they are a little stronger, but still I like to work the entire hand when we're doing these exercises. For our last one, we're going to work on cervical retraction as well as scapular retraction, just to kind of get that nervous system reset at the spine. You don't have to have a band, but if you have a band, that works well. So what you're going to do is retract your cervical spine. So I'm bringing my head back. At the same time, I'm going to pull the band apart and squeeze my shoulder blades together. So I'm going to retract my cervical spine, squeeze my shoulder blades together, and pull that band apart. If you don't have a band, that's fine. You can just put your elbows by your side and just squeeze back, retract. Hold that for anywhere between 2 to 5 seconds. Repeat that for 2 to 3 sets of 10 to 15 repetitions, several times a day. A bonus tip is a lot of times patients will use a splint that prevents elbow flexion that they can sleep in at night. So that splint's going to go on the top side here. and prevent elbow flexion. That takes some of the pressure and stress off of that nerve at nighttime, so that does work well for a lot of patients. Also, make sure that you're not propping on your elbow throughout the day. If you're riding in your vehicle for a long period of time, be careful propping on like a console or propping on your desk at work or your chair, because that might aggravate your symptoms. Thanks so much for watching. Hope this video helps for your cubital tunnel syndrome. Make sure and hit that subscribe button. That way you can stay up to date on all my content.